emergency if you are taking tablets, except metformin only, or insulin to treat your diabetes. You also need to inform your insurance company that you have diabetes. At each renewal, update them on any changes in your condition or treatment. If you have diabetes treated with insulin, there are some restrictions on your license. Your diabetes specialist can advise you in more detail about this. Before setting off and during a long journey, you should make sure you have some essential items with you, so you can drive safely and reduce your risk of accidents. Stop every 1.5 to 2 hours and test your blood glucose level. If it is lower than 6 millimoles per litre, eat some slow-acting carbohydrates, such as a piece of fruit or a sandwich. Ensure you have some treatment for hypoglycemia, food, water, and a supply of your medications. If you feel a hypo is starting, stop the car, take the keys out of the ignition and move into the passenger seat. Then treat the hypo with quick-acting carbohydrate, such as 4 or 5 glucose tablets. Then have some slow-acting carbohydrate, such as a banana or sandwich. Do not start to drive again until your blood glucose is back above 6 millimoles per litre. Regular travelling is now a part of everyday life for many people. When you have diabetes, you need to be well prepared to ensure you are travelling safely. For even short distances, such as going to work, a shopping trip, or hospital appointment, you need to be prepared for potential problems. The most common problems are hypoglycemia and forgetting to take medication. Points to remember are: have I remembered to take my medication? Should I take my medication with me in case I am delayed? Have I got my diabetes ID card with details of my next of kin? Should I take my blood glucose meter? Have I got some carbohydrate with me in case I miss a meal, such as a cereal bar, a piece of fruit, or a couple of crackers? Many people now regularly travel overseas. When you have diabetes, you should make sure you're prepared for both your journey and your stay. Your journey may be several hours, so make sure you have the following: blood glucose meter, strips, and lancets. Enough medication in your hand luggage for at least 48 hours. If you take insulin, remember to pack this in your hand luggage. A letter from your health professional explaining that you need to carry insulin and needles. Emergency food supplies and treatment for hypoglycemia. A diabetes ID card. If you plan your trip well, you will be able to enjoy your holiday without any problems. Your diabetes specialist can help with specific advice for you. For all overseas travel, you should ensure you take a simple first aid kit containing items you might need, such as plasters, painkillers, treatment for diarrhea. Have adequate treatment for hypoglycemia. Take twice as much medication as you require. If you take insulin, keep it cool and intact. Take plenty of needles, a spare pen, and a sharps bin. If required, pack some protection such as a hat, long-sleeved clothes, and high-factor sun cream. Take change of time zones into account and think about how these will affect your medication. Check if you require vaccinations and malaria prophylaxis as early as possible before departure. Whilst you are away, check your blood glucose regularly. Be aware that your usual lifestyle changes when you are away from home. You may eat more or less and exercise more or less than usual. If you take insulin, your dose may need to be altered to adjust for this.